So we're going to focus on the lower cheek and the preauricular wrinkles. So if we start with the preauricular wrinkles, you can see here that these are vertical lines that are usually quite annoying to a lot of people, and therefore there's a high demand for a nice way to correct these vertical lines. Now, if you pull the cheek forward, you can see that they are reduced. However, if you push the cheek forward, then you might aggravate other signs of aging. So the idea is to, first of all, create some volume underneath here, and then to inject actually intradermally in these lines, in these wrinkles, to reduce them. So with a cannula, I will go from the mandibular angle, and I will treat this area with normal dilution of calcium hydroxylepatide, and then superficially I will treat this area with a hyperdilution of calcium hydroxylepatide. So the danger zones, of course, to this indication are the superficial temporal artery, running basically just in front of the ear. Then also there is the parotid gland, which is of course below the SMAS, and we will stay above the SMAS. So the parotid gland is definitely not something we have to worry about. All right. So with a cannula, I will go from here. This will be my entry point. I will make a pre-hole with a 23 gauge needle, and then with my 25 gauge cannula I will use normal diluted, or undiluted in this case, undiluted calcium hydroxylepatide to go subcutaneously, just to volumize this area. So 0.1 ml retrograde. Another one. I go just a little bit closer to the ear, over here. As you can see, by just injecting here, we've already improved this area, preauricular wrinkles. Not completely done. Okay. So what is left right now is to correct the dermal area, the dermal level. And so we have pushed the tissue forward, basically thereby expanding or stretching the skin. And what we have to do now is go intradermally with a sharp needle with diluted calcium hydroxylepatide. Sharp needle. 28, please. So this is hyperdiluted calcium hydroxylepatide. This has been diluted with 1.5 milliliters of calcium hydroxylepatide with 1 ml of lidocaine containing adrenaline. So I'm going first into the wrinkles themselves, giving very thin retrogrades, intradermally. Because we have to be careful not to go too superficial. If we go too superficial, we might see kind of a yellowish, whitish discoloration of the skin due to the white aspect of the gel itself. Even though it's been diluted, the calcium hydroxylepatide microspheres are white because of the calcium inside. And therefore it makes sense not to go too superficial because of the transparency of the skin. Now, from the other side, I will also cross-hatch in a fanning technique in order to improve the overall, let's say, collagen architecture of the skin. And as you can see, I placed just very thin retrogrades, very, very thin superficial dermal retrogrades over here. Preauricular wrinkles. Now, as you can see, it's still not an optimum result, so I have to continue a bit further. Maybe go from the top here. I will leave it at this because we will have to wait for the neocollagenesis effect in order to improve that skin over here. So the preauricular area, as you can see, with a cannula, we volumized underneath this area. So with a needle, I will go intradermally, and place small retrograde linear threads in the wrinkles themselves and around them. First in the wrinkles themselves. And then I will move to the other side and cross-hatch that. 1, 2, 3. Okay. That should do.